Hi, everyone, and welcome to ACP's live remote non-CE offering. My name is Dan Calvo, and I'll be the moderator for today's non-CE course. Today's non-CE topic is In Sync, Effortful, Swallow, and Mendelsohn Maneuver with Synchrony, sEMG application and operation, and will last approximately 30 minutes. I would now like to introduce Dawn Mora, who will be our presenter today. Dawn is an SLP with ACP and a clinical program consultant. Thank you, Dawn.
Thank you, Dan. Right, I am happy to be here. I am going to go ahead and go over some information on effortful swallows and Mendelsohn maneuvers. So when we do swallowing exercises, just like any other muscles in the body, your swallowing muscles can weaken as a result of strokes, any disorders such as Parkinson's, dementia, and they need strengthening to be able to get better and function the way we want them to. And two of the most evidence-based treatment options we have are effortful swallows and Mendelsohn maneuvers. And both of those really work on strengthening all of your muscles of swallowing, from the tongue all the way through to your pharyngeal muscles to your upper esophageal sphincter. So we're going to go through how to perform these exercises using Synchrony sEMG biofeedback, because we know when you have the sEMG biofeedback, you can really determine if the patient is performing the interventions the way you hope that they are. So when you're doing effortful swallows, we're going to start with those. You're going to want to push, tell their tongue to the roof of their mouth and swallow hard with all the throat and neck muscles. And that we try to perform 3 to 4 sets of 25 swallows with a 3 to 5 minute rest break between sets. And the benefits of effortful swallows are that you increase your tongue to palate contact, you improve tongue-based retraction, which is really what is the driving force to get the bolus on your swallow to clear completely. You can increase hyolaryngeal elevation, pharyngeal pressure. You can increase the duration of laryngeal vestibular closure, which is what protects the airway when you swallow. And then you can increase the duration of the UES opening and improve esophageal motility. So your candidates that you can use effortful swallows with are patients who have oral stases or residue in their mouth after the swallow, patients who have long meal times, patients who have premature loss of bolus over the back of the tongue, and then patients who have residue after the swallow in either the valleculi, pharynx, or piriform sinuses, and then patients with decreased laryngeal vestibule closure. So this demonstrates using the bar graph visualization on Synchrony in order to perform the effortful swallows. So you instruct your patient to swallow and to get the bar above the line. And I'll actually demonstrate that here shortly. The other exercise that is really beneficial for strengthening the swallow is the Mendelsohn maneuver. And when you train that, it's a little bit more challenging than the effortful swallow, because it's actually an isometric exercise. So you're holding the larynx up. So typically we'll tell the patient, place your fingers on the front of your neck. When you swallow, you'll feel your Adam's apple go up and down. Now, when you swallow, what I want you to do is try and hold your Adam's apple up for a few seconds while squeezing your throat and neck muscles and not letting go. So you're just swallowing and trying to hold that Adam's apple up, not with your hand, with the muscles in your throat. The patient needs to have adequate respiratory support for this intervention, because you are holding your breath when you're performing a Mendelsohn. And the goal is to get the patient to hold for a 4 to 6 second interval. And we try to do 3 to 4 sets of 10 for Mendelsohn maneuvers. The benefits of it are increased duration of the UES opening, prolonged and increased tongue to palate contact, especially at the posterior circumferential parts of the tongue. You get improved coordination and timing of the pharyngeal swallowing events and improved hyolaryngeal movement. So you get an increased duration of hyoid elevation and excursion. So your hyoid bone, which sits above your larynx, is what is able to be held up as well as out during the Mendelsohn. The appropriate candidates will have residue in their piriform sinuses, especially greater than 50%. If they have premature loss of bolus over the back of the tongue, aspiration before or during the swallow. So, food or liquid actually enters the airway before or during the swallow, and residue in the pharynx after the swallow. So now what I'm going to do is I am going to share the actual Synchrony software so you can see how this works with both Effortful and Mendelsohn's. And I've already put the electrode on, so I'm all set up to use the Synchrony already. And all that the Synchrony sEMG does is just actually sense the muscle movements of the patient. So it's not like an electrical stimulation or anything like that. It is just purely reading the patient's muscle activity and providing feedback. So the first thing I'm going to do is go into the Effortful swallow, and it defaults to this bar graph visualization here, which is an excellent visualization for the Effortful swallow. And I'm going to just put in my bolus type and volume and then hit start exercise. It's going to do pre-exercise first. So it's going to get a baseline, so of my activity doing nothing. Okay, so it's gotten my resting baseline. And now I'm just going to do 3 typical swallows. So I have some water here, so I'm just going to do 3 just regular swallows from a spoon. Okay. And so I have my 3 swallows here. As long as I'm happy with them, I can just hit accept. And then it's going to take me to this bar graph exercise. And you can see here, the goal is 125%. So of the average of the 3 swallow peaks that I just did on pre-exercise. So I'm going to be trying to do 125%, so 25% harder than what I did on that pre-exercise with my typical swallow. So the patient is always competing against themselves. Ultimately, you're using their ability and trying to have them perform the exercises at a higher level than what they are able to do. And the goal is to get it up to 150%. So we're going to start at 125, and I'm just going to do a few swallows here. And you want to make sure you're doing the same bolus that you did on pre-exercise. So I'm just, swallowing with increased effort, pushing my tongue to the roof of my mouth and really squeezing those throat muscles. Okay, so I was able to do 3 above that 125%. So it actually upped me now to 135%. So I'm going to do 1 more here. So now I was able to do it above 135%. So if I stop this now, it's going to give me the information on how I did. So it shows on each swallow how hard I was able to swallow. If I look at the parameters, it shows that my initial peak was 86 microvolts. 135% of that would be 114 microvolts. And so if I go back to that summary, I can see that all of mine were above that 114 microvolts. So, for documentation purposes, you can say something along the lines of patient performed effortful swallows using sEMG biofeedback and was able to perform effortful swallows at 135% of the typical swallow on 4 out of 4 swallows. So it gives you a lot better objective data than what you have if you're just trying to do effortful swallows at bedside, for example. If I hit redo exercise, I can go back in here and do that next set. So we said we recommended 3 to 4 sets of 25. So I can start back up. I don't have to do pre-exercise again because I already did it. If I have a patient that I think would like, more game-like activities, I could switch to the kangaroo visualization and utilize that. So I can go in here, change my share a little bit, and you should be able to see the kangaroo there. And so my kangaroo is going to jump along. When he stops at the coin, that's when I'm going to do my effortful swallow. And so he jumps up and gets the coin as long as I swallow hard enough to meet the 125% mark. And so now you can see this also increased up to 135. Now it will work the other direction. So if I were to do that and miss 3 times in a row, it would actually go back down to 115% instead of going up. So again, it just shows that same information. All right, so now we're going to take a look at Mendelsohn maneuvers. And with Mendelsohn maneuvers, one thing I start with a lot when I'm teaching my patients is there's this help section on here. And a lot of times I will go and there's a Mendelsohn maneuver example, and I'll show this to my patients. So, I'll say, okay, here you're just relaxing. You might have a bolus in your mouth. And then you're going to swallow. And as you're swallowing, you're going to try and catch that Adam's apple and keep it from dropping. So your swallows at the beginning, and then you hold that Adam's apple up, and then relax and complete your swallow. And so that gives your patient a visual of how that Mendelsohn maneuver is going to look on the sEMG system, which can be helpful. So again, I would just put in my bolus type and volume, and then it defaults to the work rest cycle. If you go to the parameters on this, you can change that work duration and restoration however long you need to. So you might change it to 4 seconds, or you might up it to 6. You want it somewhere in that 4 to 6 second range if possible. I'm going to reduce the rest a little bit just for time's sake. And then we'll hit start. So it's again going to get my resting baseline because this is a new pre-exercise. All right, so that's done. So now I can just start doing my Mendelsohn, and I'm going to hold it through that green section. So there's my first one, and I'm going to do 3. All right, so there's my Mendelsohn's. I cut off the beginning a little bit. On Zoom, Synchrony doesn't always immediately respond. So there we've got it all marked. If you're happy with them, you just hit accept. And so now I have 80% of the average of that hold as my target. And I'm going to actually hit this plus a couple of times to be able to better see what my patient's performing. But I'm going to instruct them, okay, I want you to swallow and I want to try and keep your hold above the 80% line all the way through the green section. So I'm going to do a couple here. So you'd be trying to do around 10 with your patients before you give them a break. Sometimes on the first set, because they have performed some on pre-exercise, I'll only do 7 and then go up to 10 on the following sets. And so I'm going to go here to my repetition graphs and just edit to make sure it's marked correctly. Once I'm happy with that, I can go to detailed results. And on this one, it gives me the peak, like what I got on the Effortful swallow, but it also gives me the duration. So how long I was able to hold the Mendelsohn maneuver for. So my average was 4.8 seconds. And then it gives me this integrated sEMG measure, and that's measured in microvolts per second. So it's really the amount of effort that the patient is using over time. And so that really gives you good insight on any isometric exercise, on if they're able to do it with a greater intensity. So even if the duration doesn't change, so, you know, say you get the patient where they're able to hold it 6 seconds, you know, you don't want them doing a Mendelsohn any longer than that, because again, they're holding their breath. And we know 4 to 6 seconds is therapeutic. There's no incentive for them to hold it any longer than that. And so you have the integrated sEMG will actually show that they're using more effort over that 4 to 6 seconds, even if the duration isn't changing much. So this is a really nice measure of progress as they get better at doing the Mendelsohn maneuver, especially, or any other isometric exercise. All right, if I hit redo exercise here, I do have the option of like the diver visualization, for example, which is an animated visualization that you also can work on Mendelsohn's with. Change and share here. There are going to be clams at the bottom of the screen. And during that part, I'm just resting, taking my bowl. And then when the clams are at the top, that is when I'm going to do my Mendelsohn. Didn't quite hold it long enough. So we'll do one more here. All right, so you can see, you know, some patients will find the animated ones more motivating, and some patients will find the, you know, the graph ones more motivating or easier to swallow. So it doesn't really matter which visualization they're looking at, you're going to get that same data. So if we look at the detailed results again, you'll get the duration as well as that integrated sEMG measure. So that gives you all of that information. So now I can just hit done. It'll take me back out. So again, effortful swallows and Mendelsohn maneuvers are both very beneficial exercises to be able to improve a patient's swallow, the overall system for swallowing from the tongue all the way down to the pharynx and even some esophageal benefits. So they are very well researched exercises with good outcomes for patients, and having the sEMG biofeedback available in order to know that your patient is performing the exercises correctly and to help motivate them and let them know if they're being successful or not can really make a big difference in the outcomes you get for your patients with dysphagia. Thank you for attending.
Everybody have a great day.
Bye-bye.